Hi, my name is Leisha. I'm a learner at Nightingale College. Today I'll be performing vital signs skill for my BSN 206 section 15. I'm wearing pewter colored Nightingale College scrub, Nightingale College badge, and I already got my supplies, a notepad and a pen with stethoscope, analog watch, and some alcohol pad. Let's go see my patient. First, I'll clean my hand, perform hand hygiene with alcohol, hand sanitizer here. Close the curtain for privacy. Hi, my name is Lei. I'm going to be your nurse today. Can you state your first and last name?
Sure. First name is Tin, last name is Ong.
What's your date of birth?
March 10th, 1984.
Mr. Ong, I'm going to be doing your vital sign. Is that okay with you?
Sure. Thank you.
Can I take a look at your arm here? To assess vital radial pulse, I'm putting my 2 to 3 middle fingers over the grooves of the inner wrist along the thumb side. So when I put my finger here, I can feel the pulse. And the rate is normal. And the rhythm is normal. And if the rate is not normal or the rhythm is not normal or irregular, it would be bounding or thready. Thank you. Can you please put your arm across your chest here? Thank you. Mr. Ong, your heart rate was 60. Because his pulse rate was regular and normal, I multiplied 30 that I got by 2, and it is 60 for his heart rate. And normal heart rate ranges from 60 to 100, and yours is 60. Okay. For respiration, you were breathing normally. It wasn't shallow or deep breathing, and I got 8 and multiply that by 2. Your respiration is 16. Okay. A normal respiration range from 12 to 20, and his is 16, and your respiration is within range. Okay. Next, I'm going to be taking your blood pressure. Okay. Can you keep your arm straight for me here? To find brachial artery, you want to go to the front inner by the underneath the bicep here. If I put my finger here, I can feel the brachial artery palpating. And I want to put my blood pressure cuff 1 inch above that. Aligning with the right artery arrow. Clean my stethoscope here. Make sure I can see it. Okay. What's your normal blood pressure like, Mr. Ong?
Normal.
Normal?
Yes.
Normal blood pressure is 120/80, so I'm going to go above 30 mm mercury. Thank you. The first Karakov sound I heard was 122, and the fifth Karakov sound I heard was 82. Mr. Ong, your blood pressure is 122/82.
Okay.
And as I said earlier, normal blood pressure is 122/82, and yours is normal. For his age, and this is normal for his age and body build. Do you have any question for me?
No, thank you.
Thank you. I'm going to take this off. Clean my blood pressure cuff here. Perform hand hygiene. This will conclude my vital signs scale for 206, BSN 206. Thank you for watching. Bye.